Welcome to our video on best 10 foods to prevent cancer and maintain your health. Cancer is a devastating disease that affects millions of people every year. But did you know that there are certain foods that can help reduce your risk of developing cancer? In this video, we'll explore some of the most powerful cancer-fighting foods that you can easily incorporate into your diet. From colorful fruits and vegetables to healthy fats and whole grains, we'll show you how to make healthy choices that not only taste great but can also help protect your body from cancer. We'll also take a closer look at the science behind why these foods are so effective at preventing cancer. You'll learn about the specific nutrients and compounds that make them so powerful and how they work together to keep your body healthy and strong. So if you're looking for simple and delicious ways to reduce your cancer risk, you won't want to miss this video. Let's dive in and discover the amazing world of cancer-fighting foods. 1. Broccoli. Broccoli contains sulforaphane, a plant compound found in cruciferous vegetables that may have powerful anti-cancer properties. One test tube study showed that sulforaphane reduced the size and number of breast cancer cells by up to 75%. Some studies have also found that a higher intake of cruciferous vegetables such as broccoli may be linked to a lower risk of colorectal cancer. One meta-analysis of 35 studies showed that eating more cruciferous vegetables was associated with a lower risk of colorectal cancer. Including broccoli in a few meals per week may lead to some cancer-fighting benefits. Be sure to add it to your diet. 2. Carrots. Several studies have found that eating more carrots is associated with a lower risk of certain types of cancer. For example, an analysis looked at the results of 5 studies and concluded that eating carrots may reduce the risk of stomach cancer by up to 26%. Another study found that a higher intake of carrots was associated with an 18% lower odds of developing prostate cancer. One study analyzed the diets of 1,266 participants with and without lung cancer. The study found that current smokers who did not eat carrots were 3 times more likely to develop lung cancer than those who ate carrots more than once a week. Try incorporating carrots into your diet as a healthy snack or tasty side dish just a few times a week to increase your intake and reduce your risk of cancer. 3. Beans. Beans are high in fiber, which some studies have found may help protect against colorectal cancer. One study followed 1,905 people with a history of colorectal tumors and found that those who ate more cooked dried beans tended to have a lower risk of tumor recurrence. An animal study also found that feeding mice black beans or navy beans and then stimulating colon cancer inhibited the growth of cancer cells by up to 75%. According to these findings, eating a few servings of beans each week may increase your fiber intake and help reduce your risk of cancer. 4. Berries. Berries are high in anthocyanins, plant pigments that have antioxidant properties and may be associated with a reduced risk of cancer. In one human study, 25 people with colorectal cancer were treated with bilberry extract for 7 days, which was found to reduce the growth of cancer cells by 7%. Another small study gave freeze-dried black raspberries to patients with oral cancer and showed that it decreased levels of certain markers associated with cancer progression. Based on these findings, including a serving or 2 of berries in your diet each day may help inhibit the development of cancer. 5. Cinnamon. Cinnamon is known for its health benefits, including its ability to lower blood sugar and reduce inflammation. Additionally, some test tube and animal studies have found that cinnamon may help prevent the spread of cancer cells. A test tube study found that cinnamon extract was able to reduce the spread of cancer cells and induce their death. Another test tube study showed that cinnamon essential oil limited the growth of head and neck cancer cells, and also significantly reduced tumor size. Including 1/2 teaspoon, 2 to 4 grams, of cinnamon in your diet daily may be beneficial in preventing cancer, and may have other benefits as well, such as lower blood sugar and reduced inflammation. However, more studies are needed to understand how cinnamon affects the development of cancer in humans. 6. Nuts. Research has found that eating nuts may be linked to a lower risk of certain types of cancer. For example, a study looked at the diets of 19,386 people and found that a higher intake of nuts was associated with a lower risk of dying from cancer. Another study followed 30,708 participants for up to 30 years and found that eating nuts regularly was associated with a lower risk of colorectal, pancreatic, and endometrial cancers. Other studies have found that certain types of nuts may be linked to a lower risk of cancer. For example, Brazil nuts are rich in selenium, which may help protect against lung cancer in those low in selenium. These results indicate that adding a portion of nuts to your diet each day may reduce your risk of developing cancer in the future. 7. Olive oil. Olive oil has many health benefits, so it's no wonder that it's one of the staple nutrients in the Mediterranean diet. Several studies have found that a high intake of olive oil may help protect against cancer. A comprehensive review of 19 studies showed that people who consumed the most olive oil had a lower risk of developing breast and gastrointestinal cancers than those who ate the least. Another study looked at cancer rates in 28 countries around the world and found that regions with more olive oil had lower rates of colorectal cancer. Replacing other oils in your diet with olive oil is a simple way to take advantage of its health benefits. You can sprinkle them on salads and cooked vegetables, or try using them in your dressings for meat, fish, or poultry. Although these studies show that there may be an association between olive oil intake and cancer, it is possible that other factors are involved as well. More studies are needed to look at the direct effects of olive oil on cancer in humans. 8. Fatty fish. Some research suggests that including a few servings of fish in your diet each week may reduce your risk of developing cancer. One large study showed that a higher intake of fish was associated with a lower risk of gastrointestinal cancer. Another study that followed 478,040 adults found that eating more fish lowered the risk of colorectal cancer, while red and processed meat increased the risk. In particular, fatty fish such as salmon, mackerel, and anchovies contain important nutrients such as vitamin D and omega-3 fatty acids, which have been linked to a lower risk of cancer. For example, having adequate levels of vitamin D is believed to protect and reduce the risk of cancer. In addition, omega-3 fatty acids are believed to prevent disease progression. Aim for 2 servings of fatty fish per week to get a hearty dose of omega-3 fatty acids and vitamin D, and to maximize the potential health benefits of these nutrients. 9. Garlic. The active ingredient in garlic is allicin, a compound that has been shown to kill cancer cells in multiple test tube studies. Several studies have found an association between eating garlic and a lower risk of certain types of cancer. One study of 543,220 participants found that those who ate a lot of allium vegetables, such as garlic, onions, and leeks, had a lower risk of stomach cancer than those who rarely ate them. A study of 471 men showed that a higher intake of garlic was associated with a lower risk of prostate cancer. Another study found that participants who ate a lot of garlic, as well as dark yellow fruits and vegetables, dark green vegetables, and onions, were less likely to develop colorectal tumors. However, this study did not isolate the effects of garlic. Based on these findings, including 2 to 5 grams, approximately 1 clove, of fresh garlic in your diet daily can help you benefit from its health-promoting properties. However, despite the promising results showing an association between garlic and a reduced risk of cancer, more studies are needed to examine whether other factors play a role. 10. Flaxseed. Flax seeds are high in fiber and heart-healthy fats, and can be a healthy addition to your diet. Some research shows that it may help reduce the growth of cancer and help kill cancer cells. In one study, 32 women with breast cancer received either a flaxseed muffin daily or a placebo for over a month. At the end of the study, the flaxseed group had reduced levels of specific markers that measure tumor growth, as well as an increase in cancer cell death. In another study, 161 men with prostate cancer were treated with flaxseed, which was found to reduce the growth and spread of cancer cells. Flax seeds are high in fiber, which other studies have found to protect against colorectal cancer. Try adding 1 tablespoon, 10 grams, of ground flax seed to your diet each day by mixing it into smoothies, sprinkling it on cereal and yogurt, or adding it to your favorite baked goods. Thank you for watching this video to the end. We hope you found the information useful and informative. If you enjoyed this video, please consider subscribing to our channel, liking and sharing the video with your friends and family, and watching our previous videos. By doing this, you can stay up to date with our latest content and help us reach a wider audience. Thank you for your support, and we look forward to bringing you more valuable content in the future.